Now, one of the reasons that we're looking at MRIs for imaging of bone stress injuries is not just their diagnostic accuracy for those lower grades, as well as their sensitivity into the higher grades. It's really that it also does give us an idea of how long potentially these will take. An awesome landmark paper done via Honig et al., which did a systematic review and meta-analysis on MRI grade and return to sport across all bone stress injuries, shows us that there is an increasing trend for longer times to return to sport with increasing grade of injury. Now, it's important to note that there's an overlap between the confidence intervals of grade 2 all the way through to grade 4. And what that really means is, whilst on average it's going to be quicker for a grade 2 bone stress injury, there are factors at play that might mean that a grade 2 can take up to as long as a grade 4, or a grade 4 can be as quick as a grade 2, depending on how you look at it. Now, what's really important to understand in this study is that it's looking at lots of different bone stress injuries, and the definition for return to sport isn't perfectly clear across all of those different papers, so there's a bit of inconsistency. That matters a lot when we start considering our prognosis for patients, because there's a very big difference between clinical resolution or returning to running and having full return to activity. This Dittmar's paper shows that really, really well in adolescent athletes with tibial bone stress injuries, where we can see big gaps in the time to return to run versus returning to full activity. When we go and combine a variety of papers to look at clinical resolution, where they can hop pain-free or there's pain-free tenderness, which is normally when we'll start considering returning to run or returning to sport at a lower level, this is where we can start to see that in tibias, there is an increasing trend for prolonged time with higher grades of bone stress injuries. And when we pull together two studies and the varying grades of bone stress injuries and the return to sport time, we can see that there's an increasing time for return to full activity, which I believe is the true definition of return to sport, not just return to training or return to running. So, bearing this in mind, when we send a patient for an MRI, we're trying to get an idea of what grade and how long it might take, but we can set the expectation with patients that around 74% or 3/4 of tibial bone stress injuries are just going to be stress reactions, not necessarily stress fractures. A stress reaction is when edema and microfracturing is causing an accumulation of chemical processes and swelling that shows up as fluid on MRIs or other types of imaging. Now, when we start talking about stress fractures, these are about 1/4 of all of the tibial bone stress injuries, according to almost 700 patients. And this is ones that are definitely going to take a fair bit longer. Overall, across the grades, it's fairly evenly distributed in terms of grading, so we can set that expectation with our patients.